Greeting from Halal Medical. Welcome back to our channel. What is a stroke? A stroke, often called a brain attack, is a medical emergency that occurs when the blood supply to part of the brain is interrupted or severely reduced. This deprives brain tissue of oxygen and nutrients, causing brain cells to begin to die within minutes. There are two main types of stroke. Ischemic stroke. This is the most common type, accounting for about 87% of all cases. It is caused by a blockage, usually a blood clot, that prevents blood from flowing to the brain. Hemorrhagic stroke. This type is less common and occurs when a blood vessel in the brain bursts or leaks, causing bleeding into the brain tissue. This bleeding creates pressure on the brain, damaging cells. The symptoms of a stroke come on suddenly and can include facial drooping, arm weakness, and slurred speech. It is time for immediate medical attention for better chances of a good recovery. Global prevalence of stroke. Stroke is a major global health issue. It is the second leading cause of death and the third leading cause of disability worldwide. Incidence. There are over 12 million new strokes each year. Prevalence. Globally, over 100 million people have experienced a stroke and are living with its effects. Mortality. Approximately 6.5 million people die from stroke annually. Lifetime risk. Globally, 1 in 4 adults over the age of 25 will have a stroke in their lifetime. Age and gender. While stroke risk increases with age, over 60% of strokes occur in people under the age of 70. The prevalence and incidence of stroke are slightly higher in women. The global burden of stroke has been on the rise due to an aging global population and increases in risk factors such as high blood pressure, high blood sugar, and high BMI. However, with better prevention and treatment strategies, the rates of stroke have been declining in many high-income countries. First symptoms. FAST. What are the first and most common symptoms that people experience when they are having a stroke? The symptoms of a stroke often appear suddenly and without warning. The most common acronym used to remember these signs is FAST. Face drooping. One side of the face droops or is numb. When the person smiles, the smile is uneven. Arm weakness. One arm is weak or numb. When the person tries to raise both arms, one arm drifts downward. Speech difficulty. Speech is slurred, or the person is unable to speak. Time to seek help. If a person shows any of these symptoms, even if the symptoms go away, he must look for emergency medical help immediately. Other symptoms of a stroke can include weakness, sudden numbness or weakness of the leg, arm, or face. Confusion, sudden confusion or trouble understanding others. Vision, sudden trouble seeing with one or both eyes. General, sudden trouble walking, dizziness, or loss of balance or coordination. Headache, sudden, severe headache with no known cause. Symptoms depend on the type of stroke. It's important to note that the specific symptoms a person experiences depend on the type of stroke and the area of the brain affected. For example, a person with a stroke in the left hemisphere of the brain might experience weakness on the right side of their body, while a stroke in the right hemisphere could affect the left side. Any concerns? Contact us at Halal Medical, Malate, Manila, 1679, Mabini Street Corner, Malvar Street. Did you find this video helpful? Please hit the like button and share it with your friend to spread the word. If you haven't subscribed yet, subscribe now so you do not miss any new video.